maybe we can get the seminar on our way. I'd like to first of all welcome everybody after the Lunar New Year. It's really a great treat and great opportunity for us to really welcome Dr. Victor Dzau. Dr. Dzau, I think, is somebody that is well known to all of you. He has had a distinguished career, I think McGill, and then eventually St. Joseph's in Hong Kong. This is the Hong Kong boy. 香港仔嚟嘅，香港仔嚟呢個。Yeah. St. Joseph's in Hong Kong, McGill, Chief of Medicine eventually at Harvard, Chief of Medicine at Stanford, and then the President and CEO of Duke Medical School. And one of the very important things that Victor did was to actually work with the Singapore government to put a major facility between Duke University and Singapore government in Singapore. So he's really very familiar with obviously medicine, but the whole idea of implementing healthcare. And now the question that we want to study today is really the grand challenge of healthy longevity, really taking care of the older age. And that is really a challenge that none of us have really had very much experience with. To me, it is absolutely the new frontier. And most importantly, of course, Victor today is the president of the Academy of Medicine in the United States. I always call him the most famous doctor in the US. He is the most famous doctor in the US. And I think, from that background, I think Victor has taken a very keen interest in this idea of really, we call it healthy longevity. And, there's no sense living long if you're not healthy. And you don't have the money to support yourself in old age. So all those issues are all combined together with medical, social, financial issues, all coming together. And that is a real challenge. And that's why it's a global grand challenge, which I'll let Victor talk to you about. So without further ado, Victor, it's a great pleasure to welcome you here.
Thank you, Victor. Victor and I go back a long ways, but he's always known as Victor number 1 and Victor number 2. It's a great honor to be here, and Happy New Year. 恭喜恭喜. I thought what I'll do is tackle an issue that I've been very passionate about. I'm not an expert. I'm a cardiologist, and I describe myself as a physician scientist. I still do research, and my interest is how to regenerate the heart after heart attack. But this issue has been so important globally that in my new role, or not so new, so 3.5 years, as the President of the National Academy of the United States, I feel that we need to really make a global call to action and try to change this whole way we approach aging. So a lot of what I'm going to talk to you about is background information, some of which you already know, but at the end tell you how we're trying to approach this issue and hope that all of you will join us and collaborate in a global fashion. Now, I thought I'll begin by telling you who we are, that is National Academy of Medicine, and what we do. Because it is quite important to understand our background and our history. Our history enables us to take on grand challenges and possibly can actually get the world's attention on us and mobilize government and others, certainly in the United States and about elsewhere. So the first slide shows you the history of the National Academies. In 1863, during the Civil War, Abraham Lincoln and Congress thought it would need an independent body of advisors. Just like today in the United States, there's too much political issues. So a group of scholars and scientists who can advise the government in an independent fashion. So they created and chartered the National Academy of Sciences. And that over the years, this has been, as many of you know, a major academy in the world that actually asks very important questions in science and health and engineering. In 1970, a branch of a National Academy of Science was formed called the Institute of Medicine, And in fact, if you look at what we do, we in fact advise the government, advise the world about important issues. So at the bottom, you can see the New York Times call us the most esteemed and authoritative advisor on health and medicine. Report can transform medical thinking around the world. So we're very proud of this. Today, at the history, when we formed this National Academy of Science, there are now 3 academies. The National Academy of Engineering and National Academy of Medicine, which in fact used to be called the Institute of Medicine. Now, we're not in the government. We were chartered by the government as an independent group to advise the government. So we do not receive any line budget from the government. We get, of course, pay reimbursed for the work that we do. So historically, most of the requests came from Congress and from the US administration, from the executive branch, from the agencies. And now we are at a point where about 50-50. That is to say that when US Congress need to make a decision on science, engineering, in this case, or medicine, they will actually write in a provision of a bill that mandates us to do the analysis and recommendation where they can make that decision. And likewise, for us, FDA, NIH, and other agencies such as CDC will come to us to say, how do we tackle this problem? And that's what we do. We are an academy of membership first, and we have excellent members. We have 2,000 members electing about 70 a year, 80 a year to be exact. We have, as you can see, very distinguished members, 50 Nobel laureates, many people who have done great work. But perhaps the most important thing we do is to set the agenda for health and medicine, not only in the United States, but hopefully globally. And what we do is we do it through the work that we, when we generate these very important analysis and reports. I want to show you some examples. So back in 1999, the Institute of Medicine wrote a report called "The Air is Human." This was the first time in the history of medicine when a report says patients die in the hospital from preventable deaths. Patient safety was the first time this was put into action. 98,000 at the time per year in the United States of patients were dying from preventable death from errors in the hospital. Now, I was a relatively younger doctor then, and I said, no, we're the best. We're at Harvard. We don't do things like that. So it was a wake-up call. And I think the wake-up call mobilized the last 17 years of movement, global movement of patient safety. And I can tell you lots of stories about what's happened throughout the world, WHO, so on and so forth. But so that's an example of what we can do. In 1986, when AIDS was hitting the United States, and of course globally, it was thought to be a disease that affected a small segment of the population. This report pointed out that this is becoming an epidemic. And it changed the policy in the United States, and later on, PEPFAR, the one that in fact, through, as you know, the last George W. Bush to give significant foreign assistance to treat HIV. And we were part of that reauthorization of PEPFAR. In 1988, the National Academy says we should sequence the human genome. Now think about how long ago that was. And a lot of people say, that's crazy, too expensive, too much information, we'll know what to do with it. And today, we can sequence human genome for $500, less than 1,000, right? Yeah, by mail, right? And it changed the way we do things. So, and then in 2011, we say, now we're ready for precision medicine. We coined the term precision medicine. And of course, now there's still a lot of work to be done, but we all have great promise thinking about using these technology. Just recently, and in fact, I'm here to talk to Professor Lepchi Choi and others about human gene editing, because as many of you know, this technique now is so easy to use that you can actually delete a gene from the genome and even replace it. And so you can imagine the power of this technique, which is fairly easy to use to treat human disease, but also to change human gene in transmission intergeneration if you use an embryo. So we held a really important meeting 2.5 years ago, And we're now going to hold a meeting in Hong Kong. The National Academy of Medicine, National Academy of Science, Royal Society, Chinese Academy, the 5 academies will together hold this meeting in November, a second international meeting. We generate a report. And of course, we also work on pandemic and outbreaks. My good friend Jim Kim, actually my student, asked me to do this study to look at during Ebola, and we also write the dietary guidelines. So these are the examples of what we can do. And I say that in the context of what we would like to do in global aging. So at the National Academy, we have 3 priorities. First is to say, what are the really pressing critical issues that we must immediately address, even if government doesn't ask us to do it. Second is, we continue to advise our government and globally about the future of health and healthcare. What is the best way in terms of integrated care? What's the best way in value-based care, using electronic health record, digital technology, et cetera. And third is what I want to talk about, which is we feel as an academy, a global academy of prestige, we should be taking on bold ideas and inspire everybody like you to act together to address a big challenge. So that's what happened. So when I became the president about 3.5 years ago, I asked a group to say, find me a grand challenge. So we had a Nobel laureate who chaired the committee, Bob Horowitz, and a group of very distinguished individuals. We debated what's the grand challenge. But after 1.5 years, we decided the grand challenge is healthy longevity. So what I want to talk to you today is why this is such an important area. First of all, as you know, the advances in medicine and health has been amazing. The introduction of antibiotics, vaccine, in the cardiovascular area, I'm a cardiologist, the drugs, the technology, 50% reduction in mortality in cardiovascular area, right? So if you look back in 1916, this map shows you the life expectancy around the world. Red is way down there, about 20, 30 years old. That's your life expectancy in these countries. And of course, going all the way to yellow, you're dealing with about 50 or so. So it's very obvious to you, life expectancy around the globe. Without data from Africa, the gray says we don't have any data. Without data from China, we're probably dealing with 30-some years old, 100 years ago. And today, there's no red. The entire map looks blue. And if you look at blue, it's all the way up to 80 to 85, where Hong Kong, Japan, Singapore, Canada, and parts of Europe, etc. In the United States, we're about 74 life expectancy. We have double life expectancy in 1 century. It's unbelievable. If you are age 40, you won't be alive, actually in 1916, 100 years ago. And look at me. I'm active, feeling good, lots to give. You know, so life is totally different. So that's all good news. And so we don't want to look at aging as a burden. We want aging as an opportunity. Yet, because we have to have policymakers and others to start addressing this issue, because it will be a silver tsunami, right? So look at this data. If you look at where we are now, age 65, about 8% of the population, 9% is about age 65. And look at age 5. The graphs are crossing. Whereas soon we have people more than age 65 than people who are less than 5 years old. And if you go to 2050, 20% of global population would be over 65. That's 1.6 billion people. It's huge. And look at the 5 years old. So we're now really having a total inversion of our population demographic. So you may think this is all in Hong Kong, in Singapore, in the United States, but look at the graph on the top left-hand corner. The orange or brown shows you the developed countries, and the blue shows you developing countries. So the majority of people over 65 are going to be in actually developing countries. And if you think about Africa, their population is also growing rapidly, and but certainly in Malaysia, Indonesia, many areas, you're now talking about a large population from developing countries. And that's a huge issue that we need to deal with. The right side graph shows you fertility rates. We have dropped 50% fertility rates in the last, from 1960 to 2015. So if you look at the old pyramid, which is younger to older, we now have a pyramid that's now no longer a pyramid. It's like a dome, right? Soon we may have more people older than younger, and that is a significant challenge, of course, globally. Look at Hong Kong. Your median age has increased from 2006 in 10 years, from 39 to 43, but your life expectancy is now 84 years old, one of the oldest in the world. And the proportion of age 65 or older have increased from 12% to 16%. And of course, your population under 14 has shrank from 14 to 11%. This table is interesting because look at the projected percent of your population in 2031 who's age 65. That's 26%. By 2041, it's 30%. Huge number of people older than 65, and less than 15 is dropping from 21% to 11% now to 10% to 9%. So you understand what I'm trying to say, right? But that's not all bad news, because if you think about having people living older but healthier and more productive, what's wrong with that? But people do worry about the silver tsunami, right? Baby boomers. I'm a baby boomer. I already passed this age of 65, and I see that many of you may be boomer or on the way. And for the younger people, you should think about this, especially your parents, etc. But why is this silver tsunami? Because it challenged the fabric of our society. Are we ready to deal with this? Because in both industrial and developed countries, the rate of population stands to fundamentally impact how families, communities, societies, industries, and economies function. Here are 6 examples. First, of course, is illness. The older you get, the more likely you get infirmities. Second is, how do you provide the care? Most of our care are provided through the general population. But I think as you get older, you have very special needs that need to be looked at. Family structure and relationships, social infrastructure, insurance and retirement programs, and of course, ultimately workforce and composition. So I'm going to show you some of this for conversation. First, if you look at age-related diseases in US and UK, it's fairly obvious to you that the common diseases are known as chronic, non-communicable diseases. Cardiovascular, cancer, obesity, hypertension, and others, all shown here. Mental health, depression, heart failure. And then if you look at the slide on this side, the older you get, the more you get these chronic diseases. So obviously, one has to understand that the burden will go higher and we need to treat them, but maybe even more important, we need to make elderly healthy so they don't get this kind of diseases. Dementia. Many of you know that if you're over 85, 1 in 3 have dementia. Now, so the number is going up. If you look at 1 new case every 3 seconds worldwide, and expect to double the amount of dementia in 20 years. And of course, Alzheimer's is the most prevalent, and it's huge financial burden. So these are issues that we need to deal with. But my feeling is if you can prevent this, it's better than try to treat it. And that's where all of us want to remain healthy, because health span can reduce the opportunity of disease development. Family structures. Look at these 2 columns. The traditional family structure is about, 3 generations, grandparents, parents, and children. But on the right-hand column, you see now what is known as beanpole family structure. That is more and more fewer kids, right? China has 1-child policy. So then now, but you're living longer. So this is 1, 2, 3, 4, 5 generations all alive together. And with this multi-generational issues, obviously creates a lot of issues about living, but also, fewer children, rising rates of divorce, multi-generation households are decreasing. So elderly are less likely to live with their children, but maybe by themselves, and social isolation. So the whole demographic shift is changing a lot of the family structure. Look at this data in Japan. If you look at 1960, 90% are living with children, parents, 60 or over 65, and only 4% living alone. See that? Look at where it is in 2005, 10 years ago. 47% living with children and 15% living alone. And so you can see that we really have tremendous shift now in family structure, and it also creates things that you know well, right? Many of you have either at my age or have parents that age or grandparents, and you know that this is increasingly a big challenge issue for the family structure. And particularly if you think about one-child policy, now it's possible that a couple had four parents. And so increasingly we need to figure out what we can be doing going forward. Looking at workers, I talked about the fact that labor force is going to be smaller and smaller. If you look at the ratio of pensioners to workers, 2013 is 4 workers per 1 pensioner. And by 2060, we're going to have 50% reduction in those. And this, on this column over here is what they call old age dependent ratio. That is number of people over 65 who are still making your labor force. You can see that in 2050, Japan is going to have to depend a lot of people over 65 to work in order to have enough labor, as is other countries as well. China, look at this ratio of workers to pensioners. The number of pensioners have increased dramatically in terms of up to 50 million or more in 2005, and it's probably even higher than this. And so the ratio of workers to pensioners is also dropping dramatically. So another problem. Third, of course, is that I believe that happens here too. Financial challenges. I believe you don't have a pension plan. And even if you did, we have them in US, Social Security, there's just not enough retirement savings. Look at these numbers, and looking at different age groups, and particularly if you look at the age group of 50 to 61, which is shown in the green around here, you can see that retirement savings is really very small. And importantly, if you look at UK, China and US, the shortfall in savings is in the trillions of dollars going forward in 2050, and even now it's already big. So how do you actually finance and support this group? Large population, not necessarily people in this room, but many others. And of course, the gap between the haves and have-nots are also increasing. So these have social implications too, right? Social unrest, when you have bigger and bigger disparities, particularly in this context. And so the Center for Strategic International Studies created an index called the Global Aging Preparedness Index. And I won't tell you about all what is involved in there. Suffice to say that they score 20 countries to see where people are. And they started the scoring, I think, in 2013, and then another one in 2015. Here's what they found. Very few countries have made significant additional progress in reducing projected magnitude of dependency burdens. I certainly think that our country has not. I don't think maybe Hong Kong has done much of it either. And so this is significant. And many countries that do well in one dimension do poorly on the other. So maybe healthcare is good, but social programs are terrible. Financing may be terrible. So Help Age International says the countries that perform best would take a more comprehensive approach in looking at investment in pensions, access to care, supporting social inclusion. So that's the basis of my conversation today with you is, what do we need to do? And what do we need to do going forward? So I think overall, results are very mixed globally. And the reason I talk about global is because, of course, it's US, And Hong Kong, well, I think there's more conversation that I'm aware of every time I come here. We're going to see the chief executive today, that there's acknowledgement of the aging issue. I think in our country, there's even less. So Michael Murphy and I were just talking. I joined the Gates Foundation Grand Challenge in Global Health. We hosted the Funders Forum. So they come together every year to look at what's the global challenge in global health. They put in billions of dollars of support. And funders include Wellcome Trust, Gates Foundation, MacArthur Foundation, many other foundations, and governments. Grand Challenge Canada. Not a single program's on aging. I was so surprised. So Michael and I have worked with Gates Foundation. We're going to try to have a program in global aging in the next Grand Challenge meeting. Victor, I just came back from the Davos. Likewise, there's no discussion on this huge global problem. So my feeling is we really have to get the world's attention on this issue. Maybe some governments are more aware than others, but it's a global issue. And that I think ultimately we have to prepare financially, socially, and scientifically for longer lifespan and really through improving health. It's a global imperative. So we looked at this issue in 4 domains. One is personal, social, economic, environment determinants. You know how important that is, and I'll show you some examples of this. Second, of course, is healthcare medicine delivery. So it's not just healthcare. It's actually the social domains that's important. Third is the policy and financing aspect. What the government will do, what it has to do in order to create right policy and right financing for the elderly. And finally, I also believe science and technology is going to play a really big role. Breakthrough, trying to use science and technology as a way to increase health span. I'm going to talk quickly about these 4 areas. So just think about this. Daily living challenges and personal well-being of elderly. Activities of daily living, what you do every single day, you cook, you walk, whatever. Safety, security, and mobility. Social connectedness. Isolation is a big problem for the elderly, as you know. And loneliness, and a sense of purpose. I have a feeling that Victor, certainly me, continue to work like we do because we have a sense of purpose, right? And that sense of purpose of engagement is really important to contribute in a meaningful way. Can't put the older people in this corner and say, well, you've done your work, forget it, right? Even my friends who retired to play golf, their purpose is to play golf and get a better handicap. But importantly, I think that if you look at the complexity of clinical medicine and healthcare, we need to look at age-related disease, shifting in epidemiology to chronic disease, dementia, etc. But I think we look at the delivery system and look at the list of things we have to consider. And do we have an integrated system, and are the system good enough to provide the best care? And of course, financing. Who pays for it? And, and this is a big problem. If you look at US, actually bankruptcy among the aging is when they get really catastrophic illness, even though we have Medicare, right? And of course, finally, and very importantly, is social service and medical service should be integrated. Because after all, drawing a line between those two, it's arbitrary. But more importantly, having elderly access social service from a separate organization, from a medical service, is so difficult to navigate. And I'll talk a little bit about this. And of course, long-term care. Long-term care involves a number of services to meet a person's health or personal needs. And this could be done at home or actually in a facility. But this helps them to live independently, particularly at home, and safely. And especially when the elderly can't perform day-to-day activities. So this is personal care. And it can be home nursing, community care, assisted living, residential care, long-stay hospitals. We need all of the above. And of course, guess what? I have a feeling it's the same here. Most of the work by long-term care done by what we call informal workforce. It's by your family members, and maybe if you have some wealth, you can have an armor or servant, whatever, but people who are not trained to do the right things, and there's a tremendous amount of course, resources needed that's not counted, right, in the real budget as people look at it. So look at this data. This looks at where we are in 2006 to 2010 in the gray bar, and the projection going forward in 2060, low case and upper case. Every single country is going to have to increase a lot more investment in long-term care as a percent of GDP. And then, of course, you can see that informal care support is, at least some countries will provide at least support for those informal care, such as paid leave. If I have a sick family member, I can get paid leave. But in other countries, that doesn't exist. So you're going to have to struggle between how to care for the sick family member and how to actually make a living at the same time. So we got a tremendous challenge. I want to emphasize the idea of social services because food insecurity, unstable housing, social isolation, mental health, all those contribute to chronic illness. And then of course what happens is you end up using healthcare services a lot more. So you're driving up the cost of care. 80% of care actually are spent, as you know, in people over 65, at least in our country. So if you look at investment in social care, this data from Elizabeth Bradley was really opened my eyes, because we've always said US has one of the highest medical care. I mean, look at right here. It's 16% GDP. It's actually 18, 19% GDP now, right? But look at its investment in social care. 9% of GDP. So when you add those two together, US is actually in the middle. Whereas countries like France and Sweden have a balanced investment between social and medical care. Now, why am I emphasizing this slide? I think we got our priorities wrong in the United States. Because by putting more effort in social care, people are feeling better, healthier, and then we don't have to drive up this infinite cost of healthcare, right? So I think the idea is not only the issue of investing sufficiently, but also integrating the two, because you really can't separate the two. So many of us are working. I was talking to Samuel Wong and E.K. Yao's group that in fact some of the report from our foundation is about integrating social and medical care. You can drive down the cost of medical care by having much better social care. Finally, policy, economic implications, sustainability of social insurance, and many others, which I won't go into. But I want to give you one example of what policy can do. This is a policy looking at public pension as an incentive to leave the labor force for men in 11 countries. So the higher the incentive to take your pension, you can see the lowest number of people remain in the workforce, right? It's quite interesting. If you look at Italy and Belgium, 60–70% of the people over 65 are not working because they have lots of incentive not to work. And now, I'm not saying it's good or bad. I'm only using examples why public policy is important. So I just came from Singapore. I spent time trying to study their system. Here's a country that's getting its act together. From public policy, really strategically looking at the aging. They're not looking at aging as a health issue. They have a ministerial committee on aging, which has all the ministries, and they have a secretariat who's pushing forward all different areas, from urban planning to healthcare to social services. And as an example, I was telling Victor and the others, the Board of Housing Development, responsible for 80% of housing, are redoing housing for the units for the elderly, integrated in the rest of public housing. So you can have different ages, etc., having community activities, but the apartments or the flats are going to be smart enabled so that sensors and others can come in. They have guardrails and they're wired. I think that's planning forward, looking forward in the future. Public policy and finance is really important. And this is why we hope the governments will get it and start thinking about it more seriously. So there are many opportunities for innovation. For example, community social infrastructure, I won't go through in detail, but many of you know, accessibility, engagement, assistance, and the variety of things you can get elderly involved, changing the way we deliver care to having a much more robust geriatric workforce, playing emphasis on life course approaches, and not just to look at segmenting into multiple ages, health promotion, and of course, greater support for caregivers and make models for long-term care. Also, importantly, policy and financing can be looked at this area, investing in social infrastructure, pension reform, inclusive and innovative business employment practices. But Singapore has a re-employment age. So that means by age 65, by legislative, you have to so-called retire. But then by age 63, you're talking about re-employing yourself after 65. So this is a way by keeping people in the workforce and not mandatory retirement. It is mandatory, but you can re-employ. And finally, I do want to emphasize that the excitement of science and technology, because there's so much now known in age-related disease, biology, aging, and different technology. So what I'd now like to do is to say to you, by summarizing this talk, and then go to my last part of what we're trying to do in National Academy, is to say, to realize the healthy dividend, health longevity dividend, we need to address those 4 areas I talked to you about: basic research, clinical medicine, healthcare, social, personal, and environmental factors, and policy and financing. So, as I said earlier in my introductory remarks, at the Academy, we thought this would be the issue we want to take on. But don't forget, we're not a government, we don't have deep pockets, but we do have a loud voice. And so we want to say, well, let's call this a grand challenge and make it a global issue. And so in thinking about how we can make a difference, we came up with 2 components of a grand challenge. One, on the right-hand side, is to say what we need to do is to create a roadmap for the global aging, healthy longevity. We want all governments to be recognizing how important this issue is and do a comprehensive assessment of the challenges and opportunities, and of course, looking at solutions and directions. At the same time, we want to stimulate a whole area of activity so that there's more science and technology and commercialization of products for the older people, because that's going to help them. So that's the 2 things we work on. So let's talk about the first one, the global roadmap. So we have created an international commission of experts internationally. And in fact, on this trip, I want to think about inviting someone from Hong Kong to join this international commission. We have Dr. John Wong from Singapore. We have Professor Nakatami from Japan. We have from WHO, Director of the Aging Center. We have UK Sally Davis, who's Chief Medical Officer. And we have lots of distinguished individuals who are on this committee. We have met a number of times to move forward with roadmap with the idea of addressing those 4 work streams. And our idea would be we're going to work 4 parallel groups that will come together to create a final report. It's international, not US. We're happy to convene, but the commission should be international. We're hoping to take it on the road. So we come to Hong Kong, we go to Africa, we go to different parts of the world, different regions, to engage in discussion, to learn from each other, and to begin put forward a global report about what governments should do. Now, I recognize, of course, when you look at a global issue like this, you're dealing with very different diversity, heterogeneity, from Africa to Asia, etc. So the idea of such a roadmap is a roadmap. In other words, we can articulate the things that need to be done, and of course, government should take those roadmap and contextualize into what's unique about their situation in Hong Kong and Singapore and elsewhere. For example, I would think that you can do in housing what they do in Singapore, because after all, they control 80% of the housing, right? Here, developers will decide, but maybe giving incentive for developers along with policy, right, to do those kind of things for the right reason. And perhaps those apartments are worth more, right? So there's opportunity to do things like that. So we want to create a roadmap, and we now have, I just talked about this, we have an outstanding group of individuals, but I thought I would like to invite someone from Hong Kong like E.K. Yeo and others who's doing a lot of work, or Jin Wong and others, to join us, because this is truly an international effort. The second thing is, at the end of the day, if we think about policy can only go that far. Many of you know, just look at this, right? Have you thought about this 10 years ago? But the technology can be so amazing that we can really help people who are older to be more functional, more mobile, healthier, happier, less isolated, and through technology. So there's really many promising research that's being done, and we feel that using technology we can transform the way in which we can help the people who are older. Now, Victor was really nice to host me for an event. How long ago was that? About 9 months ago, 6 months ago, right? We have some of your experts in aging together talk about this idea. But look at this. Here's where we are in biologic research. We know a lot of things, but a lot of things are in animals and models and not enough in human. Now, a lot of people jump from animal observation to human, and that's actually not a very good thing because it's creating bad reputation about what's the evidence, etc. But we do know we have epigenetic clock that can measure DNA methylation that can predict biologic aging much better than chronological aging. The question is, can this clock be a measurement of health? Because if you have a certain measurement of this clock epigenetic, and if you do an intervention such as caloric restriction or some of the drugs, can you actually reverse the clock, right? So that's the kind of research that needs to be done and measure biologic biomarkers and then look at the molecular pathways. There are trials now ongoing with metformin that look at, large trials to look at whether it's possible to reduce the onset of age-related diseases. And of course, rapamycin, mTOR, is already available. So there are telomeres, DNA damage. So there's enough to say, how can we help this information get to the next level? Engineering and digital technology. I think this is going to be so important because already we have, sensors to get people fall and emergency responders, pill boxes, and GPS tracking device, and telehealth and remote patient monitoring. But look what's coming down the road. Artificial intelligence, robotics, smart homes. My mother, my late mother, who lived in Canada, when my father passed away, she was isolated at home. She can't go anywhere, and we have to order taxis and transportation. I think that autonomous vehicles, and of course many things can be now make elderly a lot more mobile. Virtual reality, and of course all that. And this is Nora. I think that one of these days each one will have our own assistant, which are intelligent assistant. We can help us do everyday tasks, manage chronic diseases, monitor my blood sugar, look at what I'm taking, how much activities, provides care anywhere, health IQ, and plays the role of information agent. That is actually totally within reach, I believe.
Device.
Yes.
Alexa.
Yeah, exactly. Right. Right. Exactly.
Okay.
Right. I just call it Nora.
Okay.
Yeah. Right. Well, I think within the next 5 to 10 years, these are possible. Question is how we're going to deploy it, right? So our idea is to catalyze breakthrough research in this field. I'll take a step back. As I look at research in this population aging, there's really two types of research. One is geriatric care, and second is the biology research, which are mainly animal. We need to bring them together. And of course, there's social research and engineering research. Now imagine that if we can bring this together, we can really make a huge difference in terms of healthy aging. So what's wrong with this picture? Well, if I think about the tech world, there's so many apps and things, people doing things, but very few working on this issue. But if you were a business, you step back and say, look at the size of the population, and look at what's coming. I should be getting into products for this group. So our idea as an academy is we're not going to take any intellectual property, but we want to stimulate people, teams of people to work on these questions. Whether young people, so they begin thinking about, wow, aging research is cool. We want to do aging research, to serious scientists who say, wow, we can really have some breakthrough. So our idea is to create prizes and awards, right? Hackathons. Now in Singapore already, through hackathon, they came up with 3 different companies in Uberizing a lot of activities, in helping, first of all, they have, the Ubers already have this, they made a deal with Uber so that the elderly can be transported fairly easily. But then if you go from moving from the home to the site where Uber pick up, now there's a lot of different services which are Uberized. Likewise, you imagine that they can have pill counts and all those stuff. So if one imagine that one creates what we call Catalyst Award, funding just good ideas. So we learned that from a Gates Foundation Exploration Prize. Tachi Yamada is the chair of this committee. He was the head of Global Health and Gates. And the idea is to give out, decent but not huge awards just to get people interested in the field. And the idea here is to say, just write us a good idea. You don't even have to have any preliminary data, and we will look at what's most innovative. And then catalyze more and more young people and others, teams of people coming to compete. In phase 2 is when you have this funding, and then you can look at how much of those ideas came to more likely fruition. Experimental, human. And then we're going to create grand challenge and get people excited to say we can win the challenge. So I want to tell you 2 stories. 2 weeks ago, the SpaceX was launched. SpaceX is part of a commercial space industry. How did that happen? Through the X Prize, called Ansari Prize. $10 million of that prize created multi-billion-dollar industry. So I'm hoping that we set the right goal, people will come in, and of course, people will see the opportunity to invest and to create a whole space for lots of new products. Our job is to catalyze and stimulate the field. In Singapore, they told me that they created a Lee Kuan Yew World City Prize and asking cities to compete for improvement in many domains, and it's very successful. So we're hoping we create a prize or prizes that can people to say, yes, we want to compete in this prize. But then through the competition, a lot of new ideas have come that can actually, if you even don't win the prize, can stimulate the area. And the catch to what is to get people excited. How many people have heard of Dean Kamen? Dean Kamen is a super innovator entrepreneur. He invented lots of things, one of which is that, what do you call that, the Segway, yeah. So Dean Kamen has created a thing called Global First. He's bringing together young people from everywhere, Afghanistan, teams of people to compete on robotics. And they have 1,000 young kids working together in competing. From China, from Afghanistan, from US, etc. And the excitement is there. And what we hope to do as an academy is to get people excited about how important this area is. So we have a great prize design committee. I won't have time to go over it. So this is my last slide. I think that we need to talk about healthy longevity, not just living old longer. That's no longer a challenge. And not just about diseases, but having health span when we're getting older. And how do we achieve that? It takes a village. But we as the academy would like to at least charge forward with call to action through a roadmap, get governments being involved and others, and then activate the science and technology to create a whole space of new ideas to help the elderly through a Grand Challenge Prize. So thank you very much.
Do we have some time for a few questions? Yeah.
We do have a group of common core students outside.
Oh,
Although this is on,
Yeah, we'll be getting
being
some
broadcast.
questions.
okay.
Yeah. So, anybody in the room?
We ready to act? Yes.
Yeah.
Yeah. This is why I don't have a solution, but I would say that this is why this has to be on the agenda of your government, or all governments, right? I have a feeling we're going to talk about this today when we see our chief executive. But you know, she kind of gets it because she's got a social service background, but we need to act. And you know, I was looking at Singapore, they have a lot of different finance schemes for the elderly, as you know. They created a new thing called LD Shield, right? But they're actually looking at people who are the founding, you know, members of that country, right? Between 1940, born before 1949. But they have multiple schemes. They also help you monetize your apartments and, you know, things like that, create annuity. So I think it's a really good idea to start thinking about programs such as this. But your point's well taken.
But
I'm not
Vic-
an economist, so
Victor, I don't think it can be just a government issue.
yes.
I don't think any government will have enough resource to take care of the whole problem. So I think the government have to come up with the, you know, taking on the grand challenge with the frameworks to encourage participation by the private sector. And how
Very
do you
good
fit
point.
all those pieces in? I think it's going to be a really, that actually is the grand challenge.
Yeah, you know what?
How to fit the private sector and the public sector together in actually harness this.
Victor, you're right on. As you know, Friday I spent time with your friend Tharman, who chaired the eminent persons group of G20.
Yes.
And they dealt with 3 topics. One is fintech, cryptocurrency and what it means and a whole bit. These are eminent economists and previous finance minister. Second is AI and Facebook. And third is healthcare. And guess what? The conclusion clearly is we've got to pull private sector in. Right? If you're really going to have coverage for everyone, how do you get private sector more investment in this area? Yes. Yeah.
Thank you for your nice lecture. One of the things I don't think you really mentioned was about, you know, the United States, for example, immigration, and you know, with the growing elderly population, and you know, what kind of, you know, different countries have to, probably Japan and Germany have to bring in people from outside because they won't have the young population inside. How will that be done?
No question. And I mean, thank you for pointing it out. Obviously, it's a very critical, how do you solve this problem of the demographic challenge? You know, United States has to date a good immigration policy. Look at me, I'm an immigrant, right? And hopefully going in the future, we continue to have good one because we need to solve. So you're quite right, depending on which country, and that is a critical, important issue, no question about that.
Victor, I think let me take a question from people outside. This is an interesting one because he says, I'm one of those young people you talked about who thinks aging research is cool.
Good.
Okay.
I'd like to meet that person.
No. He's wondering what are the major challenges you face in convincing people and foundations to fund aging research rather than age-related disease research. And I
Great
like
question.
might add, how would you
Yeah.
really challenge young people to think this is cool?
Yeah.
To get the young people involved in the aging problem.
Yes. Okay, so on the first question, Michael Murphy and I have been working really hard in looking at support, and we are getting really good enthusiastic support. We raised a few $1 million from individuals and from foundations as well. We are talking to significant organizations, and surprisingly, there's a lot of interest even in areas such as industry. Because in the price that we do, we will make the selection. We will look at the cohort. But guess what? We're helping companies who are into engineering, technology, et cetera, create a much better network, if you will, a net to capture opportunities. So we're working on this, certainly in terms of fundraising. Now, in terms of coolness, we'll start a hackathon, right? Get the young people together, think about what are the new
cool.
ideas.
That's cool.
Yeah,
A
you know,
hackathon.
yeah.
But you know, Victor, one thing I would really emphasize for you is, you know, one thing you have, one currency you really have, is convening power.
Right.
Don't underestimate the convening power, the ability to get diverse groups together from different fields. That you may not have the funding, right? You say the U.S. government doesn't fund you with a line,
Yeah.
but you have the convening power.
Yes, thank
Not
you.
only in the U.S. but globally.
Yes.
And I think
That's what
that
we
is
do.
crucial to this effort.
Yeah.
Now, I'm going to take a question in the room. Yeah.
That's
please.
Paul from Hong Kong. When we talk about healthy aging, I think we also talk about not only looking at the aging people, we also have to spend emphasis on the soon-to-be old people too. I think when we are talking about it, so when those are old age, there's not much you can do, but once they go to the old age, we should in terms of the infrastructure, about the policy, the social public policy, the leisure policy. I think for the Hong Kong government, I think now we are talking about we have $140 billion of the surplus. I mean, they just have to know how to target measure, do it nicely. And then for the Catalyst Award, I think it's a wonderful idea, and I do believe that I think in Hong Kong, our young people have a wonderful ideas. I think if the Asia Global Institute or Mr. Victor Fong yourself, can take up this initiative, and I think there will be a lot of good ideas can come out. Thank you.
Thank you. You're so right. Clearly that, if you're healthier at age 40, you can be healthier, right? And we recognize that. That's why one of the slides said life course, right? Health span and life course. My talk is focused on this population because there's a real need. But obviously we can dial as far back as we possibly can, even in early childhood, right? There's no doubt, no denying about this. Yeah.
OK 我们今天非常荣幸有一位客人廖先生中国的V Doctor 来的你有一个问题是吗 Oh, he's speaking.
Yeah, for me.
Dr. Dzau, as you know, China, the population of age 65 plus in China is increasing to 240 million, and it's increasing, and it's rising right now. So, what would be your suggestions to Chinese government from the perspective of Chinese government and business sector?
That's my next step. Next stop. Okay. You invite me to come to China, and I'll meet with your government.
Sure. We'll be glad to.
I think that will be a grand challenge.
It's
that
true.
Will be the
Yeah.
next step.
So certainly we have very good connections. Our members include Zhou and others. So I've been talking to him about this, and we want to really stop in China and look at. Because your country is so big, obviously, that's one of the challenges, just like our country. So each, from east to west, very different, right? It's difficult to make simple policy. So I don't want to just simply be simplistic, but I would love to have that conversation and think about how we can do these things together.
But as you say yourself, Victor, these things transcend ministries,
Yes.
single ministries.
That's true.
It is really something that we need to address right at the top of government. Now, there's a question here, but I'd like to get one there first. And then here's an interesting one. We're talking about longevity and how can you sustain healthy longevity in a world where there's shortage of food and shrinking natural resources?
Yeah.
And the whole environmental sustainability problem is wrapped up into this.
Well, I don't think they're mutually exclusive. Particularly if you think about when you can sustain healthy longevity, you can probably continue to have economic development and more productivity. So one is not taking from the other. One, in fact, may be providing more resources for the other. But I understand this very important issue. I work on many of these fronts as well.
But let me push you one more
Okay.
step. If in fact we're not getting healthy food, doesn't that feed into your question of healthy aging?
Of course.
You are what you eat, right?
Yes.
So really, the causes of health, sort of lack of good health in aging,
Yeah.
could be a function of the consumption that you've had your whole life.
That was that gentleman's question, right?
Yeah, exactly.
Right? I mean, you really have to look at healthy living much earlier. The earlier you do it, the better it is. Again, today I emphasize the population because of the tremendous opportunity and challenge. But to do it right, it's really the entire population. It's even early childhood. I mean, you know how important early childhood is in the determination of intellect and health. Education is so important. Human capital index that Jim Kim talks about. And importantly, if you look at famine, in terms of stunting, 25% of the world's young children are stunted because of malnutrition.
Yeah.
Right? So it's a global issue. So I do think that there's enough, there's a tension in some of this issue. I just want today focus on aging, but they're not mutually exclusive.
Right, right.
Yeah.
Yep, the question here.
Thank you for the introduction. You mentioned Singapore as one of the examples of potentially there may be more front runners in implementing some of these healthy longevity ideas. Are there other examples of countries that are sort of front runners?
Yeah, you know, in Hong Kong, certainly there are things you do really well. What I've been really interested is whether these things are done across the system or whether they're doing in pockets. So there are good models, but they need to expand across system, and this is where the government comes in. I think Sweden does it really well, right? They have a system that's a social and healthcare well integrated, highly invested into the well-being of their people. So there are models, but as you saw in the gap index, very spotty. Most countries can do one thing well, not the other. So we have a long way to go.
This is another interesting one, Victor, here. With increasing globalization, and capitalism in the private sector has a larger and larger focus on youth. We now talk about millennials all the time,
Yeah.
et cetera, et cetera. How can you get this focus to shift to the elderly?
Well,
The trend is going the other way.
yeah, so that's why I'm making the following argument. One is that it's really an opportunity for the private sector. Victor, kind of your
Yes.
point, right?
Yes, yes.
It's opportunity in the private sector. There is in fact a lot of opportunity to say this is a big market and we can actually invest in this area, right? So,
if
yeah.
you take a pure business approach, if you take a pure business approach and take those numbers and translate into potential, let's say from a private sector businessman standpoint, potential markets, I bet you that is not going to be smaller than the youth market.
Yeah, if you look
In
at
fact,
the
it's a
graph,
huge
yeah.
market and growing market, and probably there's more room for innovation. And the point, I would turn this question around to say, because it's not that much in people's top of mind, there's less competition.
Yeah, great opportunity.
So it's actually a great business opportunity.
Yeah, exactly.
From a business standpoint.
Yeah.
I'm much less worried about that because the older people have more money, so they are the payers, they're the spenders. But I have another question, not too related to this. You have emphasized on the financial and care providing dimensions that comes from aging and so on, but less on the social dimensions. Let me be less abstract, because right now I'm teaching a course, Finance and Society. At this very moment, the topic is on the history of marriage, of human marriage, how it has changed and so on, to deal with the challenges that come with risk events and so on. So what would be your recommendation in terms of the optimal marriage response to aging, right? Do you think, for example, Trump is setting up a new model for everyone, given that he has married how many times? Anyway, because the traditional form of marriage is supposed to be for perpetuity, right? So if everyone would live 150 years, then if they still would get married at the age of 25, so big.
Very dangerous question. We're encouraging.
So I'll let.
It's not necessary to do marriage.
I'm a scientist, so you have to study this. It's true, right? Because you can argue on different sides in terms of the turnover in marriages. But don't forget, we have a system in the United States of alimony and many issues. So you can argue that you actually would have a larger family base, or you don't. And you have different financial issues. So it's a very complicated question.
See, a lot of these social institutions developed when life expectancy was much shorter. So now it's many times over. So do the same institutions still work, or will they still work?
That's a good point. You pointed out a very sharp example. Does the long life expectancy affect a lot of these social institutions, including marriage?
What are you teaching in your class? What do you tell them?
Only very interesting topics I teach in my class. So, thank you.
Right. So you said that this is a very important question, but there are so few or so little investment on this, and then many governments around the world are not really investing or aware of this problem. And Victor, number one, pointed out that this is a great business opportunities. But then we all know that there are so many talents and genius in business and governments, and they are not doing this. So my question is why? Is there any hidden problems underneath all these?
Well, maybe Victor can answer this better.
I would say that at least if I look at my government, it's because of the short-term achievements they need to do versus long-term. It's a very complicated issue. Requires a lot of investment and a long-term outlook on the outcomes. And I think that's one of the issues. Most people are just saying, really, we have such a big debt, trillions of dollars, how are we going to try to even invest more and tackle these issues? The political will is frequently not there. If you look at so many things in our country, whether it's a state level or federal level, frequently the political will is not there.
Maybe let me try and attempt an answer to that. I think this issue has sort of been in the background, not very vocal. People have not been. The youth issue has been very much vocalized. That's the first point. And this problem, I must say, the severity of the problem have crept up on us. And nobody actually has done enough analysis to know it's going to hit. That's why you call it a tsunami.
Yeah.
People didn't realize it was a tsunami. Maybe it was just sort of building up in the background. People
and the fertility rate going down.
Exactly.
And, all those things going on.
The different things converging. And so the problem actually is coming into this consciousness, social consciousness, very suddenly, and crept up on us, so to speak. But it's urgent, and it's very, very, very much beginning to be. And I can tell you, the private sector is focusing on now what we would call the silver hair market, right? And Japan is leading the way, actually. Japan is coming up with the products and the services that are very innovative in serving this market. But this is a relatively recent phenomenon, and I like to emphasize that we're really going into the total unknown. This is we don't know anything about this. This is all new experience. The world has never experienced so many people living so long. It's a new frontier. So it's like almost an exploration. So that would be my answer. Yeah, KK.
On this particular point, can I also add the observation that actually you're talking about the reaction of the market of the businesses. A lot of private practice doctors are making huge amounts of money. The specialist doctors know that the markets are expanding rapidly. It's very difficult to book an appointment with the very famous specialist doctors in Hong Kong nowadays. But then the problem, I think, is when you go to the public sector, it's a totally different issue. The public sector has
That's a
been
very good point.
suffering from the point that the more successful you are, the more customers you have, and the more heavy the financial burden will be on the government. So from the public sector's perspective, what they have to do from time to time is to control the expansion of the services. Medical advances and pharmaceutical discoveries actually put extra burden on the public finances. So in the public sector, we're using queuing to stop all these demands from materializing. The workers in the public sector are working under severe pressure. So I think you are going to see a much bigger social divide because of longevity and medical advances.
Yeah.
So it's creating actually a new pressure point in the future.
Yeah,
That's a very,
that's a very good point.
what do you think?
He's right.
But the more money you pump into the government knows that the more money you pump into the public sector, the more customers you're going to attract.
So just quoting back to I said earlier about that eminent presidents group meeting, I was using the argument that we should invest in health. Now, first, aging is well beyond health. Okay, I recognize that, but invest in health. Larry Summers wrote some very important paper where he looked at
Larry Summers.
Yeah, Larry Summers. He's published some very important papers about how, if you look at investment in health, that eventually by 2035
You actually
have tremendous gains, economic gains. He's calculating just economic gains alone, the last 10 years, about 11% growth in economic growth in improving health alone. But going forward, he used a thing called value life years. That's you economists know how to do that, like disability adjusted years, right? And if you include that, the amount of return is huge. And Jim Kim's been using human capital index. He's got data to show that if you look at 15 countries, 27 countries in the last 15 years, the low quartile and high quartile in human investment in human capital index, that's education, housing, healthcare, the percent of growth in GDP is 1.25% per year over 15 years. So the point here is you can't see investing in social and healthcare as a burden. That's what health ministers do. They have to see this as investing for actually growth and for the future. And take Tsunami. So Larry invited me to a dinner with all the finance ministers. It was pretty intimidating. I was the only non-health guy. And we talked about this. He asked me to give them the data because we did the analysis looking at Ebola outbreak and convert it into the last 10 years. Peter Sands, who's now the head of Global Fund, who's a chartered, Standard Chartered Bank. Yeah. So we had Harvard scientists do the analysis. And if you look at 10 years, the economic loss globally per year is $60 billion a year over 10 years. So by investing early and reduce the outbreaks, SARS, whatever, the economic return is going to be much less, right? So Jim Kim set up a thing called the Pandemic Emergency Facility, Finance Facility, which is a reinsurance program. And again, he invited me to Davos and a small of reinsurance people discussing this. He showed the data that now if you can mobilize $100 million at the beginning of Ebola, you would have saved 4 to 7 billion downstream losses from trade, travel, you name it. I just think that the finance people got it wrong. They look at short-term issues. How do I balance a budget? This is long-term investment in the much less loss over time and much more gain.
I think what Victor has just said is absolutely crucial. You see, the question you ask, KK, is really looking at just one side of the equation. How do we see this as a problem, and how do we minimize the cost of dealing with the problem? What we really need to do is to link this to the productive side of society. The old people into the continue to work in the workforce, etc., is going to contribute. And if we actually make this a positive linkage, it would actually, you know what Larry said, I didn't realize he was doing all this work.
Oh yeah, now I'll send you the
Yeah,
paper.
okay, that's great. You know, link it back to the, in a sense, the positive side of society. Then you look at it more holistically. Don't think of it as just a problem and you're minimizing the cost of dealing with the problem.
Yeah.
Now, if you really isolate it in different ministries, what do you expect the health minister to do?
That's exactly it.
Right? I
Yeah.
mean, I mean it's much more of an overall leadership societal issue that has to be handled across ministries at the top. You see, I think that's really the...
Yeah.
Now, I think this is a very fascinating debate, and I think all of you would know that we're at the beginning of a very, very important issue, not only for Hong Kong, not only for China, for Asia, but for the world. And I think we really like to thank Dr. Victor Dzau for actually putting this in front of us. So on behalf of all of you, Victor, thank you very much. Thank you.